and welcome to Round Robin. I'm your host, Robin McCormick with the City of Hampton. And today we're going to talk about breastfeeding and how important it is. And don't get squeamish or turned off, because I think this is something everyone needs to hear. My guests are from the Health Department, Megan DeWitt and Meena Tamakloe. Hello.
Hi.
I'll say from the start, I feel really passionate about this. But you guys are the experts, so why don't you tell me why it's important for women and babies to breastfeed when they can.
So the World Health Organization and the American Academy of Pediatrics recommends that women should breastfeed at least for the first 6 months. And after that, of course, we add baby food, but if possible, to continue breastfeeding until the baby turns 1. Now, there are so many benefits that comes with breastfeeding for both the baby and the mom. So for the baby, the benefits are reduced. They don't get sick a lot.
Right.
You know, when you talk about constipation,
they
diarrhea.
get some of your immunities through that.
That's
through
correct.
That breast milk.
Because through breast milk, you have all the nutrients that a baby would need for at least for the first 6 months. So they don't get sick a lot. You know, the rest. They don't get constipated a lot, diarrhea, some respiratory diseases, even allergies. Now, I had a mom that was breastfeeding actually, and then ended up getting mastitis. Now, she had to switch to formula, unfortunately. Now, she had to go through so many different kinds of formulas because the baby
was allergic. And I've had some relatives that had that too. Yeah, it's a real, had to switch to soy milk and all kinds of different things. So it's healthy. I mean, it is what was designed to nourish your baby.
Exactly.
Healthy for both mom and baby.
So how does it help mom? And I'm going to say you lose your weight faster. And that maybe shouldn't be the most important thing in the world, but it is important. We need our self-esteem. We need to get back, you know, that energy. It really does helps. I think it helps tremendously there.
That's absolutely true. Yeah, you definitely lose weight when you're breastfeeding, especially if you're exclusively breastfeeding, meaning you're not adding any formula, no food, nothing. It helps you lose weight faster. Also, for the mom, your risk for breast cancer, ovarian cancer is definitely reduced when you breastfeed. The other thing is it helps your uterus go back to its normal size. And then, most importantly, you save money.
You
save a lot of money. And then if the baby's not getting sick, it means you're not taking more days of work.
Right.
I also felt like, you know, I was, as a new mom, my parents weren't here. I didn't have family in town. I was real insecure about what to do. And it helped me, you know, it's like a go-to thing because it is nutrients, but it is also security and warmth and bonding and all those things. And it gave me, you know, this sort of like super mom bonus skill that helped me figure things out. It was really important to me.
Yeah, just to tie into that, research shows that if 90% of families exclusively breastfed for 6 months, we could save nearly 1,000 infant deaths and like $13 billion in medical costs just from breastfeeding. So that's huge.
It is huge. And okay, cost-wise, and I will literally say I never used formula, never bought it, never used it. What they gave me in the hospital, I gave away and donated. But how much do you save over that 6-month period of time? Has someone calculated that? Do you know?
I have not, but I know, I think it's like $12 a can. And I was actually talking to one mom yesterday, and the special formula that she uses is $22 a can.
Wow. For that, for a child with allergies.
So that's a lot.
And even if you're going back to work and you have to buy or rent a breast pump and, you know, a few bottles and storage and all that stuff, that's still cheaper, still a lot cheaper, even with, you know, the extra equipment that you might need.
That is very true. So now the good thing is that most insurance companies will cover breast pumps.
See, they didn't when back in the day. It didn't. You still had to rent it even.
That's correct.
They didn't have these cute little at-home kits.
That's right. So now you can get it through insurance. You just have to check if your insurance covers it. But at least with Medicaid will cover breast pump. So moms should know that they can call. They can also have access to lactation consultant.
Now, let's talk about that, because I think, what we see is that a lot of moms give up early on or have some trouble, and a lactation consultant can help you get through some of those hurdles, because it's not uncommon to have a hard time. It's not uncommon to have an infection or to just feel like you can't keep up when that baby goes through a growth spurt and all you're doing, it feels like, and it can be a little painful at first. So there's this learning curve, and so our grandmothers aren't around necessarily to help us pass down that wisdom that they used to. So a professional lactation consultant, you run classes.
That's correct. So breastfeeding has its own challenges, and that's what I tell moms.
And I want to be honest,
it's not easy. It's not going to be
not
easy.
At first.
Not at
Boy,
first.
At some point, it is the easiest thing you can ever do. You don't have to pack up that diaper bag. You don't have to. I mean, it's so simple, but there's a learning curve.
That's right. So just like you said, we have lactation consultants when you go to work. If you're WIC recipient, you have access to a peer counselor who provides education and support. And most of these peer counselors have breastfed, so it's good for them to share the experience, and they really help the mothers very much. Now, just like I tell parents, if you are able to, most of the time, the issue is with latching. If they don't get a proper latch, most of them end up stopping. So I really encourage mothers who want to breastfeed to make sure that initially they get help from a lactation consultant, or if they go to work, they have to make sure they talk to a peer counselor.
And you want to do that early on, because as you said, if the baby doesn't latch on, the baby's not getting the nutrition. And you don't want the failure to thrive. I mean, it's supposed to work, but it's not like I know instinctively how, or even the baby always knows instinctively how. Their muscles might not be working. It sometimes takes a little while to catch on. Other people get it, I think, pretty quickly.
Yes.
So what makes women quit feeding or feel uncomfortable about breastfeeding? I mean, there's social issues, and then there's the physical going through it challenges.
Right, and we have talked about the physical challenges already, but the social component is huge because it's not normalized in our community anymore. So in 2015, Virginia law was passed that now protects mothers to lawfully breastfeed any place they're legally allowed to be. So no longer can a woman go into a restaurant, breastfeed their child, and be asked to leave, to go into a bathroom to feed their child. So that's huge for moms. Meena and I both sit on the Consortium for Infant and Child Health Breastfeeding Work Group, and their goal is to improve the lives of children in our community. And in this case, it's by education, awareness, and making the community understand that this is normal, this is natural. And
it is. And in most cases, gosh, I don't know if I can say this, you're not really hanging out there. I mean, the baby's covering up the crucial parts. You've got a blanket, your shirt. I mean, there's a whole lot of ways to do this pretty discreetly. I have God, this is embarrassing. But I have had meetings at work, and I was on maternity leave, but coming in, and I was doing a startup for a magazine, and I would drag that baby into the meetings. People didn't even know, for the most part, what was going on. I mean, really, you can do this in a pretty discreet way. Now, if you get an older kid who's wiggling, it's a lot harder. But with the babies, it's not so bad.
No.
And I've had waiters and waitresses who didn't notice, and now I have also had one that asked me to stop. I'm like, yeah, that's really not going to happen. But as you said, I wasn't protected. They could have thrown me out. I probably wouldn't have gone. But, it does make some people uncomfortable.
And when you think about it, we walk through the mall and we see this life-size Victoria's Secret poster of a woman in half a bra.
Yeah. Much more is hanging out.
Exactly. But again, it's
a
not,
different connotation.
It is. And that's what we want to get out there. So through different projects. Breastfeeding Welcome Here is one project that we work on to help promote awareness, promote support within our communities by going to local businesses, museums, and just asking them to take a pledge and just put up that National Breastfeeding sticker in their windows so that when a nursing mother walks by and sees that, she knows that she's welcome there, that she can breastfeed there. And the other component of that is educating their staff, educating them on the new law, letting them know that breastfeeding is not considered indecent exposure. So you don't have to cover up your baby. You can
Right.
breastfeed anywhere at any time.
And it can be a challenge. As I said, I've been in airports, I've been in malls. I mean, you kind of become expert at finding a quiet little place, because quiet does help too.
Absolutely.
For the baby as much as, for privacy. And there's been completely different. As I said, one person complained, and it wasn't the restaurant. Someone complained to the restaurant. But I've also been places where, older gentlemen, like my grandfather's generation, said, "I'm glad to see that, feel comfortable." And, I thought maybe, he's kind of looking at me, this could be weird, but he's like, no, it's my generation, that's what everyone did, he said.
Yeah.
And I don't see it as often. So I think we are sort of getting back to those days. It can be hard if you're working. And I'll say, I think it's a real challenge, and we need to be honest. I think some of the reasons women did it is it gives you more freedom. You can be away from the baby for more than an hour and a half. And you need that as a new mom sometimes. So you do have to figure out, but the pumps are much more accessible now. There's and you can, supplement once in a while. There's all kinds of ways to achieve the goals we wanted to achieve and still achieve the things that are the healthiest for our babies and for ourselves.
Absolutely.
I'm doing all the talking. I'm so sorry. This is a really important issue to me. I feel really
It is an important
strongly
issue.
about it.
And I do want to mention while we are talking that now that the new law is in effect, women are still experiencing some of this.
I don't believe. Oh, that's shocking to me.
It is,
Like,
it is
really?
shocking nowadays to imagine that that's occurring, but it is. But if there is a violation, of course, mom can always just talk to the owner of the business as kind of a first step. But if
right.
they want to report a violation, those violations are now reported to the Virginia Department of Health. So they can go online to vdhlivewell.com/breastfeeding. There's a link they can click on to report a violation, as well as a phone number that they can call into.
And that is really not so much about a fine or but educating people
Correct.
and explaining to them what the law is and
Yes.
what they need to do to accommodate people.
Absolutely.
And I think, I was lucky at work because I was, by then an upper level manager, and I had my own office. All they had to do was install blinds on the window, and we
Okay.
were good to go. But a lot of people don't have that freedom. And
No.
workplaces, too, have to have I actually got the first one installed at the Daily Press because I couldn't give up my office when other women went to breastfeed. So we made one, and it was off the nurse's station, but, and let it be known that it was there because people need that. It's
Yeah.
hard to go back to work. It's really
It is
hard.
hard. Yep.
You're torn. You love your job. You love your kid. So how do you balance that?
Yeah.
And workplaces can make it easier if they want to.
They can, and they don't necessarily have to make a specific lactation room. If there
Right.
is a
It doesn't have to be
small
only.
office space with a locked door, a chair, and a table, if possible, running water, but if not, just a private space for mom to go pump, do what she needs to do, and then get right back to work. So
Honestly, it didn't take that long. It does at first, when your
Right.
body's still building up, but man, I could be in and out in 10, 12 minutes tops. And I did stuff while, your hands are kind of free. You're working on your phone or emailing.
Right.
It's nice to take a nice quiet break. Really, that was what it would be best for.
Sure.
But you can juggle everything, but you need resources. So, Meena, tell us again, what are some of the resources that you and the health department provide?
So again, like I said, for WIC provides the lactation
And
peer
WIC is the
counselor.
Federal Women's Infants Children
That's right.
Supplemental
Women-
Program.
That's correct. So for WIC, they provide a peer counselor who is there to provide education and support. WIC also, if you're going back to work or you're going back to school, they will loan you a breast pump, and that's a hospital-grade breast pump, very good breast pump.
Yeah,
that
you want
they
the
can,
good ones.
That's correct, that they will loan to you to use. And also, if, like I said earlier, if you're on Medicaid, you can also call, and all you have to do is call Edge Park, or they can ask their doctors, they can ask WIC to get a 1-800 number. They just call and it's mailed to them. So it's very easy to get that.
So low-income women have some options through these
That's
federal
correct.
programs.
That's correct.
And you said a lot of insurance companies cover breast pumps, cover lactation consultants. Most of the hospitals and you know, the pediatricians and the OB's offices have those networks too. You might have to ask,
correct.
but they can help you connect with the resources.
That's
Yes.
correct.
Okay. Is there anything you guys want to add before we close?
Well, I just wanted to add that with most moms, like we're talking about going back to work, that's when most people stop. And I usually encourage moms that before you go back to work, make sure you pump a lot. Okay, you have to start pumping a lot to store it for when you get back to work.
Right,
And then
right.
also they do not know that an employer has to provide them a space, you know, to breastfeed. And the time that they have to take out to pump, that should be besides the lunch time, right? They need additional time
Right,
to
right.
pump. So they
Yes.
have to ask. Sometimes they don't know, so they don't ask. All they have to do is to find out, can I get a place? And I've seen where even supervisors.
How can I? This is my favorite way to tell people. Don't say can I. How can I? How can we accommodate this? How can I get the time and the place that I need? And what's most convenient for you? Because you've got some flexibility. I mean, at first you've got to go pretty often, but it gets a little easier, you know, after that 6 or 8 week period, depending on how quickly you go back to work, or 3 month, or whatever, you know, you get to take.
And I know WIC is doing a breastfeeding celebration in August. I believe it's August 11th. So they're inviting all moms who are breastfeeding to take part in it.
That sounds great.
Absolutely.
Thank you.
Thank you.
And thank you for watching. I hope you do understand, if you're in a public place and you see a woman breastfeeding, she's allowed to do that. And, you know, consider offering support instead of judgment. And if you are a woman, or if you are a partner of someone giving birth, it does take a lot of support. All of us can work together to help make moms and babies healthier and happier, and that'll strengthen our family and our community. Thanks for watching.